Below is a much more detailed, expanded, and professionally structured explanation of dermatophyte test medium, DTM culture, suitable for clinical manuals, laboratory soaps, or academic notes. #dermatophyte test medium culture, detailed overview. Number 1, Introduction. Dermatophyte test medium DTM culture is a specialized laboratory technique used for the detection, isolation, and presumptive identification of dermatophytes, a group of fungi responsible for superficial infections of keratinized tissues, skin, hair, and nails. These fungi cause a family of infections known as tinea or ringworm. DTM is particularly valued in dermatology, podiatry, veterinary medicine, and mycology because it provides rapid, visual, and inexpensive detection of pathogenic dermatophytes. The medium contains color indicators and selective agents that help differentiate dermatophytes from contaminants and saprophytic molds. Definition: Dermatophyte test medium, DTM, is a selective and differential culture medium that promotes the growth of dermatophytes, contains antibiotics to inhibit bacterial contaminants, includes cyclohexamide to suppress non-dermatophyte molds, uses a phenol red indicator that changes from yellow to red in the presence of dermatophyte metabolic byproducts, ammonia, alkaline substances. Thus, DTM serves both culture and diagnostic functions. Number 3, indications. A DTM test is ordered when dermatophyte infection is suspected based on symptoms. Key indications include skin lesions, annular, scaly patches, central clearing with raised edges, classic ringworm, persistent rashes unresponsive to steroids, nail onychomycosis, thickened, crumbly nails, white, yellow discoloration, nail plate deformity, hair scalp, tinea capitis, patchy hair loss, black dots, broken hair stubs, flaky scalp with itchiness. Veterinary indications: cats and dogs with circular hair loss, horses and cattle with skin lesions, screening in shelters to prevent outbreaks. Other uses: confirm diagnosis before systemic antifungal therapy, investigate recurrent or chronic infections, identify zoonotic transmission. Used for DTM culture is specifically used to 1. Detect dermatophyte fungi in skin, hair, and nails. 2. Differentiate dermatophytes from yeasts, e.g. candida, saprophytic molds. 3. Provide presumptive identification via colony morphology and color change. 4. Support species identification along with microscopy or other fungal media. 5. Aid in clinical decision-making regarding proper antifungal treatment. Number 5. Why do need of this test? The test is needed because dermatophyte infections mimic other skin diseases. Eczema, psoriasis. Topical antifungals used blindly may cause misdiagnosis or worsening. Some cases require long-term systemic therapy, which should be confirmed microbiologically. Helps prevent inappropriate antibiotic use. Detects dermatophytes in pets, which can infect humans. Provides a cost-effective method for diagnosing common fungal infections. Without confirmatory testing, up to 40 to 50% of suspected fungal nail infections may be misdiagnosed. Number 6. What happens during the test? Procedure in detail. A. Sample collection. A healthcare provider collects samples from the active edges of lesions. Skin, gently scraped using a scalpel blade. Flakes or scales are collected. Hair, epilated, plucked, hairs removed from the affected area. Brush technique may be used for children. Nail clippings and subungual debris are taken from the diseased area. Proper collection is crucial for accuracy. B. Inoculation. The collected specimen is gently pressed onto the surface of the DTM agar. Do not bury the sample. Surface inoculation ensures visibility. C. Incubation. Medium kept at 28 to 30 degrees Celsius, room temperature acceptable. Avoid exposure to direct sunlight. Jar or container may be used to maintain humidity. D. Observation. The culture is examined daily for 1. Growth of colonies, 2. Color change, yellow, red, 3. Colony texture, pigment, and morphology. Dermatophytes produce alkaline metabolites, which cause the medium to turn red within 3 to 7 days. Non-dermatophytes may also cause color change, but usually after 10 to 14 days, making early timing important for interpretation. Number 7. How long for my results? Early, presumptive, result, 3 to 7 days. Typical result, 7 to 14 days. Full identification, up to 21 to 28 days. Interpretation depends on time plus appearance. Number 8. Prepare for this test. Preparation is simple, but accuracy depends on avoiding contamination. Do not apply topical antifungals for 24-72 hours. Do not wash the area right before the test. Avoid lotions, oils, or steroid creams. Inform clinician if you are on oral antifungals, you recently trimmed nails, you have used home remedies, tea tree oil, vinegar, etc. Number 9. Risk to the DTM test is safe. Minor risks include small discomfort during scraping, minimal bleeding if skin is abraded, nail clipping pain. There are no systemic risks. Number 10. Normal values. Normal, negative, no fungal growth, medium remains yellow, no dermatophyte colony develops within 21 days. Number 11. Interpretation results. A. Positive dermatophyte result. Medium turns red within 3 to 7 days. Colonies are typically powdery to velvety, white, cream, or buff-colored. Rapid color change suggests dermatophyte metabolism. Common species: Trichophyton rubrum, Trichophyton mentagrophytes, Microsporum canis, common in pets, Epidermophyton flocosum. B. Negative result: no growth or only contaminants. Medium stays yellow, no dermatophyte colony observed. C. False positives: non-dermatophyte molds such as Fusarium, Scopulariopsis, Aspergillus may cause late color change. Color change alone is not definitive. Morphology matters. Number 12. Factors affecting results. False negative causes: recent antifungal use, improper sample collection, insufficient specimen, contaminated or expired media, incubation above 37 Celsius, kills fungi, washing or cleaning the area before sampling. False positive causes: overgrowth of saprophytic fungi, leaving the culture incubated beyond recommended time, environmental contaminants. Number 13. Clinical significance. DTM culture plays a vital role in diagnosing dermatophytosis tinea infections, guiding antifungal therapy choices, differentiating between dermatophytes, non-dermatophyte molds, yeasts, avoiding misdiagnosis of conditions like eczema, psoriasis, contact dermatitis. In veterinary medicine, essential for controlling ringworm outbreaks, determines carrier animals, supports quarantine decisions. Know more. Additional points of interest. DTM is often used with KOH microscopy, Sabarot agar, or lactophenol cotton blue staining for definitive identification. Dermatophytes use keratin as a nutrient. Common sources of infection: humans, animals. Soil. Dermatophyte infections are highly contagious. Many countries require culture confirmation before prescribing oral antifungals, e.g. itraconazole terbinafine. Number 15. Conclusion. Dermatophyte test medium, DTM, is a simple, economical, and effective diagnostic tool for detecting dermatophytes responsible for superficial fungal infections. Its ability to provide rapid visual confirmation through characteristic color change makes it essential in dermatology, veterinary practice, and clinical mycology. Though interpretation requires careful timing and correlation with colony morphology, DTM remains one of the most widely used methods to confirm fungal infections and guide appropriate treatment. Thank you. Have a nice day.